NIH Director.
Thank you. Senator Sanders.
Thank you, Mr. Chairman. Dr. Bhattacharya, as I mentioned a moment ago, in some cases we pay 10 times more for prescription drugs, the same drug that people in other countries pay. Something like 1 out of 4 Americans can't afford the prescriptions that their doctors write when they get sick. Why do we pay the highest prices in the world by far for prescription drugs, and what will you do if you are confirmed as NIH Director?
I don't have a full answer to that question, but I agree with your concern and the fact that we do pay the highest prices in the world for prescription drugs. If I'm NIH Director, if I'm confirmed as NIH Director, I think there's a very specific thing that we haven't done, but we should do. The NIH should fund research on off-label use of off-patent drugs, inexpensive drugs. I'll give you an example from the pandemic, Senator. There was a tremendous achievement, I think. There was a study done in the United Kingdom of a cheap steroid called dexamethasone. Very early in the pandemic, if used during...
I don't mean to, I apologize, but I don't have a lot of time. And I hear what you're saying, and I'm not in disagreement with that. Question is, historically, the NIH has, as we all know, spent billions of dollars in developing important drugs. And yet, despite that taxpayer expenditure, we end up paying far more than other countries. Should a company that benefits from the taxpayer dollar research, basic research at the NIH, be able to charge any price that they want? Or should we attach to those contracts a reasonable pricing clause that says, hey, if we help develop this drug and it's effective, you're going to have to charge a reasonable price for it?
Senator, that's an issue where I think previous NIH directors have said it's very difficult for an NIH director alone to take action. I think that's something that Congress and the administration would have to work together.
Not quite true. I think what we're learning from the president is a lot can be done through executive orders. And I would disagree with you. I think that's something that the NIH can do. Would you be open to that idea?
I mean, Senator, I guess I would focus on the future. Imagine the NIH focuses on support for relatively inexpensive.
Okay, I'm hearing a no. Right? Okay, let me ask you this question. We talked about life expectancy, very important issue. Why is it that working class people in America live 7 years shorter lives than the rich?
Senator, it's the chronic disease crisis in large part.
But why does somebody who is working class end up with more chronic disease than somebody who's wealthy?
I mean, I think, Senator, that's something I've devoted my career to trying to understand. I think that it is a tragedy that there's such a dispersion in life expectancy based on income. I think the solution that an NIH director, if I'm confirmed, I would fully commit to this, is to address the health problems that lead to that outcome. The rise in obesity, the rise in diabetes,
Again, I apologize for interrupting, but what role does the food industry out there sells a lot of crap to our children, right? And they spend zillions of dollars on advertising products that are really not healthy. What will you do about that?
Senator, I think excellent research to try to find alternatives to make clear the link between the junk food that kids eat and subsequent health outcomes can convince parents, I hope, to make better choices for their kids, to help them make better choices for their kids. I think the role of research is to elucidate those connections and give people tools.
But you're going to have, if you're confirmed, a bully pulpit, so to speak. Would you support what a number of countries around the world are doing in saying to the food industry they cannot do TV advertising for unhealthy foods?
I mean, if I'm confirmed, I would absolutely advocate for to give parents the tools they need so that their kids will eat healthy.
I'm answering the question. Sounds like a good politician here. There are TV ads, as we speak right now, telling kids to tell their mothers that they desperately need some food which is really unhealthy. There are countries who say that those ads should not be allowed on television targeted to kids. Would you support those of us who agree with that?
I mean, if there's a movement to encourage advertisers to not push unhealthy foods, I certainly would be willing as director to say that.
You could lead that movement, not be. Will you help lead that movement?
I mean, absolutely. We want to make America healthy again. I don't know specifically how one would lead such a movement, but I'd be willing to work with you, Senator, to do that.
Thank you very much.
Senator Paul.
Senator Sanders, I'm glad to see that you're interested in junk food. In fact, I have a great offer for you. Probably you could transform health more in our country by one policy change, and that would be removing junk food, sugar drinks, chips, Twinkies, ding-dongs from food stamps. We have an epidemic of obesity, particularly among our poor, particularly among those on food stamps. Why not just take the food formulary and make it healthy food? We do this for WIC. We decided for pregnant women that we do. But I've had a bill out there for quite some time. I have no one from the other side of the aisle, so I'm glad to hear of your concern for junk food and hope I can get you to consider that.